So lighting a lamp has given us a divine grace. And with that, we go ahead with our next session. And it is a plenary address.
Hello.
Yes, so we go ahead with our next session.
So, Dolly,
About-
give it a moment. This is the fellowship sheet which is there in your bags, delegate bags. And this is what we are unveiling today. But because we are running late, we would be sharing it on table. If anybody would like to read through it. And formal launch of this fellowship will be after 15th August. So we go through this. It's there on the virtual platform also.
So the details are there on the website. So moving ahead to our next session, it is about evolving composite NCDs management in India. We all are thinking about COVID as a primary culprit and primary disease, but we have something already in our hand, and that is non-communicable diseases. So we would be discussing about how to composite it, how to manage it, and a way forward. For this, I invite Professor Dr. Shivram Varampalli, who is a co-chair IPS task force of on mind body medicine psychiatry from Bangalore. Over to you, sir.
So this bringing together all NCDs on a common platform has been a dream project for Dr. Gangadhar for quite some time now. And to briefly introduce Dr. Gangadhar, most people of course know him because he recently received the Padma Shri Award from the Government of India. But before that, for us psychiatrists in India, he has been an icon and a legend in many ways. As Dr. Raju referred in his address, he initially started with work on schizophrenia, ECT, electroconvulsive therapy, where he has been a legend in both these areas. And in the last 10-15 years, he has moved into the area of yoga, mind-body medicine. And now, of course, in the capacity of the president of one of the boards of the National Medical Commission, he is tasked with guiding the way that MBBS is taught in India. So it's a very important position that he's currently holding, and he would be telling us these views on the current epidemic of NCDs. So for all of us, even before he got the Padma Shri, he was already sort of iconic figure, and even more so now that he is in a position to actually sort of suggest changes in the medical education. And all would be waiting to hear his views. Please go ahead, sir. Thank you very much for being here virtually and in the middle of a busy schedule. We're all waiting to hear you. Go ahead.
Since you have introduced me, I don't have to put this slide. What I will be addressing today is to illustrate how from treatment alone to correction of the biological strata or biological basis or biological substrate of the disease would bring in a more comprehensive treatment. I will illustrate it using depression as the model of one of the NCDs. I'm sure similar thing would be available for illustration for other diseases as well, NCDs as well. So let me proceed with what I intend to present. What I want to say is, in addition to the body and mind, the where health is defined, earlier days people also included the spiritual dimension of the health, and the Ayurveda used to say prasanatmendriya manaha swasthya ithya vidiyate. So wellness of spiritual dimension was also a very important thing. Why is this important in my talk today? Is that, for example, treating a condition called as depression, the one of the concepts of spirituality, feeling of connectedness, has been become made important for inducing benefits in depression when yoga is practiced. And so this is the reason why a spiritual concept to the illness, spiritual concept to the wellness, and one of the toolkits for changing health of spirituality, which is yoga. I'm bringing them together and trying to see how the whole uh, puzzle can be resolved. Uh, Yoga is, of course, a way of life, a spiritual way of life, and it is a toolkit for improving spiritual health. So, having said this, let's look at where yoga has been found to be helpful in psychiatric disorders. A host of them, of course, the list is here: depressive disorders, schizophrenia, anxiety disorders, and so on and so forth. For many of these, we have already developed what we may call as a modules, which are also called as generic modules of yoga for treating these conditions. So we have had challenges in examining each of these with respect to the practice of yoga in these conditions, starting from looking at their use as mono or adjunct and so on and so forth. Many of the challenges we have partly addressed, and what I would illustrate is the biomarkers which will help us to understand that the treatment yoga not only is symptomatic of helping the individual come out of the current distress, but also correcting a host of neurobiological substrate of the disease, which gets the individual more comprehensively benefited. And these observations that yoga benefits in these conditions have already been put into some of the international guidelines. For example, the Canadian guidelines for mood and affective disorders treatment includes yoga as a adjunct treatment in the treatment of depression. And likewise, even in schizophrenia, one of the national guidelines by the NHS includes yoga as a treatment for chronic psychotic disorders. So yoga has come to play, but what I need to demonstrate is how we can understand a comprehensive mechanism by which yoga benefits this disorder. Take, for example, depression. There is a cycle of events that are both causative and are because of the depression having emerged as conditions which will predispose the individual to a cascade of biological changes leading to from the state of decreased frontal activity, which is claimed to be causing depression to begin with, which leads to increased activity of the limbic system. The limbic cortices having become more active lead to less inhibitory control on the brain, which releases the HPA axis, leading to increased production of cortisol. Cortisol in turn reduces the brain repair mechanism by inhibiting the levels of the brain neurotropic factor, which in turn goes on to cause reduction in the gray matter, which would again cause the reductions in the frontal activity. So it's a vicious cycle. Depression having been set in, it is a cascade of events which takes the whirlpool down and down. So our treatment would be to get the depression better, and in turn also demonstrate that all these points of the cycle are also corrected. And does yoga do this unchaining mechanism of the entire depressive whirlpool is what I would like to demonstrate in this following few minutes. The neurobiological evidence or the markers which I would like to demonstrate is how the limbic system is disinhibited, increasing the GABAergic activity of the brain, lowering of the cortisol levels, increasing of the brain neurotropic factor, and thus leading to neuroprotection and improving the brain connectivity. So this cycle is what will let us understand that the treatment with the depression is not just a treatment symptomatically, but also is a correction towards which I'll be alluding to towards the end. Take, for example, when I have to teach yoga, amongst the many yoga treatment protocols, Om chanting is one of them. In depression yoga module also, we have this Om chanting. When Om is chanted in healthy subject, this is an illustration from healthy subject. We haven't really done this on depressed individuals though. The limbic cortices become hypoactive, deactivated. This deactivated limbic activity is conducive to depression because we know in depression these areas are hyperactive. So what this deactivation of the limbic cortices by this Om chanting as a part of the yoga therapeutic module, what does it next lead to? It leads to the increases in the neuroinhibitory transmitter GABA function. Yoga increases GABA function. Of course, this we have many ways of measuring. For example, we use what is called as the cortical silent period. I don't want to go into the details of how do you actually measure the cortical silent period, but the healthy subjects before yoga have about 40 to 50 milliseconds of cortical silent period. 1 month after practicing of yoga, this actually doubles even in healthy subjects. So inhibitory control of the brain is perhaps better, which is perhaps mediated by this deactivating effects on this emotional control parts of the brain, the limbic cortices. So the brain has able to master itself, to inhibit itself and gain what we may call as more calmness in the process. So this work has been replicated in, for example, depression. In depression, as against the healthy subjects, this brain inhibitory function is not as much, and so much so the cortical silent period is much shorter in depression than in healthy subjects. The blue and the dark yellow bars of this graph on the left hand you can see. These depressed subjects were categorized or classified or randomized into either walking as an intervention or yoga as an intervention. Both these physical activity measures actually produced improvement in depression, and this improvement was also associated with increases in the cortical silent period, but that occurred only in the group of people who received yoga as an intervention, not in the group of people who had walking as an intervention. What am I trying to say is the yoga not only produced improvement in clinical symptoms, but also was changing the brain physiology, increasing the cortical silent period, affecting the individual to master the inhibitory control on his own brain. So, improving the cortical inhibitory mechanisms, improving it through the mechanisms involved in that, the GABAergic neurotransmission. Elsewhere, people also have demonstrated the actual levels of GABA itself went on to increase in depressed individuals compared to pre to post yoga levels. In the pre, the GABA levels were lower, and the post, the GABA levels were higher. This was possible because of the magnetic resonance spectroscopic examination, which can measure in vivo levels of GABA in healthy individuals in the brain. Next, this reduces the HPA hyperactivity, and so much though cortisol levels drop. More patients who received yoga actually obtained reductions in the levels of the cortisol. The dark red part of the bar is the numbers of individuals who actually obtained reductions in the cortisol levels following yoga. As you can see, yoga with medicines and yoga alone both produce this effect. Medicines, of course, did not. Again, a word of caution that this was not a randomized treatment, but suffice to understand almost 2/3 of the patients who received yoga obtained reductions in the levels of cortisol. Now, what does this mean? This would subsequently add on to the brain protection mechanism. Cortisol is known, heightened levels of cortisol in stress produces the brain damage, and even here the brain damage would occur. One of the mediators of brain protection is the brain-derived neurotrophic factor, which is impaired in depression. The blue bars on the left box are those of the BDNF levels in depressed individuals compared to that of healthy individuals. Depressed individuals having lower values than healthy individuals. You treat depression, the values go up. The red bar, it indicates that it went up. The BDNF levels went on to get better, indicating improved mechanisms of repair of the brain. And that happened in yoga as well. Both the right-sided pairs of bars indicate that following yoga treatment with or without medicine, the BDNF level went on to increase. In fact, we were able to replicate this earlier finding almost now 8 years later. The total BDNF values are higher following yoga in untreated individuals with major depressive disorder treated with yoga alone. And in fact, we went on to examine whether this benefit was a hidden potential in these individuals' body itself. In these individuals, we took out the mononuclear cells and put them to a in vitro test of actually a stress, what's called as lipopolysaccharide exposure. These mononuclear cells of depressed individuals who have actually been treated with yoga. So before yoga and after yoga, these individuals' mononuclear cells were extracted. The lipopolysaccharide exposure was given, which is a in vitro test for stress. In these individuals, those before yoga compared to after yoga, more BDNF was released when they were exposed to the stress. So in other words, stress mediated protection by way of increase in the levels of the BDNF happened in individuals who actually were treated, and after treatment this happened, but before this was not happening. So both direct evidence and indirect evidence indicate brain protection mechanisms following yoga are enhanced through this mechanism of BDNF. And you know that in depression, BDNF values are much lower. Ignore this graph. This is a very complicated effect size coincidence graph. Suffice to say, the message is in depression, BDNF levels are lower. It gets better when you treat the individuals and they obtain values closer to that of the levels of the healthy individuals. That is the message in this. And so yoga also produced the same effect. Very interestingly, in our observations, we found in those individuals where the cortisol levels dropped, in 24 of them, as against in 11 of them where the cortisol levels did not drop, the levels of the BDNF went on to increase in those individuals who had a cortisol levels having been reduced, indicating perhaps a negative relationship between cortisol and the brain repair mechanism through BDNF. So this having been demonstrated, elsewhere people also have found that age-dependent loss of gray matter, which will occur in most of us in even healthy individuals who did not practice yoga would perhaps be attenuated had they been practicing yoga chronically. The flatter line is that of the yoga practitioners, and the slanted line is that of the healthy individuals who did not practice yoga. So with yoga not having practiced, all of us would be losing our gray matter with age, but that could be attenuated had we been practicing yoga chronically. So having said this, the same effect is translated into depression. The depression effects on the brain is perhaps attenuated and mitigated by the practice of yoga as a treatment here. Even as short a term as 6 months of exposure of yoga in elderly subjects who had mild cognitive impairment. As you can see, the yellow spot there, which is the place of hippocampus. Hippocampus is the nucleus which is first to lose its gray matter in elderly individuals. And by now, my hippocampal gray matter will be smaller than my hippocampal gray matter had it been studied, let's say 5 years or 6 months or 1 year ago. Instead of this shrinking with 6 months of practice, yoga actually led to increases of the gray matter of the hippocampus. What may be the causes of this increase? What are the ways in which this is measured? It is out of the purview of the present discussion. Suffice to say, even longitudinally, yoga is known to produce improvements in the brain gray matter, not only preventing its loss, but also improving its repair and production. Along with this, there is also increased connectivity of the brain, which can happen and which can be a contribution to our health as well. For example, this is not in depression. Perhaps same would occur in depression had we studied. We have not yet studied. Nobody else has been. No other group has studied this with depression in yoga. But I am demonstrating this improved connectivity across one of the networks called as the default mode networks, both anterior and posterior, in a schizophrenia subject. Although we have recently completed the study, we are to report this. The connectivity demonstrated by coherence of the network connection increases following the treatment of yoga in schizophrenia individuals. So correction is possible. Correction is happening with yoga, even in ill individuals, by way of a cascade of events starting from disinhibition of the emotional centers, cortisol, brain repair mechanism, increased gray matter, increased connectivity, and so it would perhaps help in undoing what we would be calling as Chita Dahati Nirjeevam, Chinta Dahati Jeevanam. You are continuously stressed, continuously depressed. You're going to lose gray matter in those red areas which have been demonstrated, which is an universal finding. Not that once upon a time our Subhashita said that. Even today, modern researchers have demonstrated Chinta Dahati Jeevanam in a brain neuroimaging research. So, completing the story, on the right hand side, you see that cascade of events in depression. Depression caused by or causing decreased frontal activity, leading to increase of the emotional centers, for example, amygdala, causing reduction in the brain inhibitory mechanism by way of decreased GABA activity, and disinhibition of the HPA axis, increasing cortisol, which interferes with the brain repair mechanism, reducing the BDNF, which leads to cortical thinning, and which in turn also leads to decreased frontal activity, increased depression. A whirlpool goes on and on and on. Chita Dahati Nirjeevam, Chinta Dahati Jeevanam in depression. And that is precisely what is prevented if you have been practicing yoga. It increases the frontal act. Of course, it does decrease the emotional centers, improves inhibitory control on my own brain. It makes my brain calmer, and the individual also gets calmer. The HPA disinhibition is prevented, cortisol levels drop, the increased levels of BDNF happen, prevents cortical thinning and loss of gray matter, and in turn also improves the frontal activity, and the cycle is brought back from that spiral pool. So yoga mechanisms are not just treatment, but also a correction. So in other words, it's a corrective treatment, and yoga has to be used as a mind-body intervention in the treatment of NCDs, where whether it is diabetes or hypertension, where you can of course control the diabetes, blood sugar levels, or the blood pressure in the hypertension. Rest of the cycle of events that the diabetes or hypertension have caused on the body, or the source of what has made the diabetes come up or the hypertension come up, both perhaps would be undone if yoga has been the intervention, in addition to, of course, where required symptomatic treatment with the allopathic drugs would perhaps make a treatment most comprehensive. Let me thank a lot of my colleagues who have worked in the yoga center of NIMHANS when I was the professor there, and most of this work was possible. And I thank all of you for being with me in this very important symposium. Thanks to the organizers, Sanjay Padke, Dr. Marwale, and team for having invited me to be in this plenary talk. Thanks a lot. All my slides, the slides have the email address in case there are any questions to be asked. Thank you. Thanks a lot.
Thank you very much, sir. I think it was a comprehensive demonstration of what depression does. And there is a lot of work recently again done by Dr. Chaturvedi and team along with Dr. Sartorius, showing the relationship between diabetes and depression. In fact, they are parallel processes which seem to happen almost together. So what applies to depression should really apply to diabetes and other NCDs as well. So thank you, sir. Any questions to Professor Gangadhar? Yes, sir.
I am afraid at your end, this mic has to be louder. I cannot hear anything from your end. I see no reason. I think there is some software hitch.
In the treatment of depression, what is more effective, the yogasanas or the breathing exercises like pranayama? On which topic?
Okay, thank you, sir. Yeah, I understand this question has often come up in most of my talks. The yoga practices that we did here in these studies included yogasana and pranayama. The pranayama included, if not very specifically, Om chanting is not necessarily called as pranayama, but in addition to the Anulom Vilom, which we have been practicing in this series, yogasana. Yogasana is expected to be done mindfully, and the individual all through the process is focusing on the parts of the activity, both movements and also synchronizing these movements with the breathing in or out or holding. And that mindfulness is a part of the meditation, which is either separately practiced in some yoga practices, or most people say that practicing good yogasana as taught in the Patanjali itself is also a meditation combined with yogasana. So this is what we did in this practices.
Sir, thank you. Thank you very much for that interesting session. I have one question. You said like this was a practice for 12 weeks or a period of duration that they have practiced. Are these changes that have happened remained permanent, or did they reverse back to normal? Should they be continuing this practice for long? So
Yeah,
that
it's a very good question, madam, and thank you for raising this question. In all our studies, we have looked at a 12-week intervention as a investigation. I wish we had the resources and wherewithal to continue following up of these people for a longer period. Many challenges were there, even in these studies. For example, whether it is schizophrenia or in depression, to have these 30 odd subjects or 40 odd subjects to complete our studies, we had to end up taking as many as about 200 subjects in the process. So we realized that in follow-up, there will be further attrition, and we decided after 12 weeks, we may not be able to continue these investigations. Although I would love to have these things done, three important things are being examined today in our research groups. One is not so much of biology, but whether are they adhering to these treatments at all after the initial improvements have obtained. Here it is the challenge. Most people don't adhere. We know whether it is medicine or yoga, it is going to be very difficult to maintain adherence, and that will actually compromise all our investigative approaches. Second issue which we are examining is early intervention actually has undone the cycling effects in these particularly recurrent disorders like depression and example schizophrenia, which are known to occur repeatedly. Even if 12 weeks of practice would it delay the next episode longer than otherwise had they been not practicing in this for 12 weeks. So adherence and undoing of the cycle. And of course, third is your question, madam, whether these biological correction would it remain forever? Though the third question is financially currently preventable, and we won't be able to meet it at this point of time.
To add to that, what Dr. Gangadhar said, one of the things that has been shown is the effects of a single 1 hour session last up to around 8 days. That's what has been shown. And when we say regular yoga, we mean at least minimum of 3 days a week, without which it's very likely that the changes may not sustain. So that's, even it's like take it daily. Yoga has a slightly longer effect than medicine, but even then it is not permanent. At least we are not being able to show it to them. All right, sir. Thank you very much, sir. Pleasure again seeing you again.
Thank you. Thank you so much.
So unfortunately, we can't felicitate you. You are virtual. So anyway, when we meet you, we will do that. Thank you, sir. I hand over the session to the MC.